Hi, my name's Richard Jones and I'm the independent chair of the Leeds Safeguarding Adults Board. Thanks for taking time to watch this video. What we wanted to do was to share with you what we have learnt from the recent experience of 3 people who lived in Leeds, who lived seriously self-neglectful lives, 2 of whom sadly died as a result of them not being able to care for themselves. We wanted to explore what it is that we've learnt from their experiences to ensure that we all know what it is we need to do to better support people who self-neglect. As chair of the Leeds Safeguarding Adults Board, I wanted to say that it is always important to support and engage people who self-neglect, irrespective of the fact that often you're told to go away or that they don't want support or help. Self-neglect is not a lifestyle choice. Your role is to understand the risks that a person faces, but importantly to understand the person, to work through and understand what might lie behind their self-neglectful behaviour, and to think about what it is that would make a difference for them in their life. Working with others, thinking about issues of mental capacity, and getting advice and support. These are the key messages that we want to explore with you, that you always need to be aware of and informed by.
My name's Grace and I'm the named nurse for Safeguarding Adults for Leeds Community Healthcare Trust. I try to support staff by keeping them up to date with relevant training. Always care. A is for awareness. Be aware of the signs and risks. Understand that self-neglect is not a lifestyle choice. Develop your skills and knowledge about what self-neglect is and why people might neglect themselves. Learn from others, access supervision, reflect on your own practice. Know the importance of seeking clarity and support from within your own organisation and from the many services across the Safeguarding Adults Partnership.
Hello, I'm Hayley and I'm a member of the Touchstone Safeguarding Group. This is a co-produced group of staff, trustees and service users. We promote learning, improving quality and provide experience from a lived experience point of view. Always care. L is for look for the person I am, the person behind my behaviour. Be curious about me. Ask questions sensitively and be respectful to get the essential details about my life to help understand what's happening to me now. My life experiences and history began before we met. So be interested in this, in my identity and in my individual needs. What's the bigger picture? What will make a difference to me and what will keep me safe?
Hello, I'm Ian Harker, a housing officer at Housing Leeds. I support vulnerable tenants. Always care. W is for what's really happening. How much do we know about this person and their life, their relationships, their history? Have they had traumatic life experiences? Are they experiencing domestic abuse, coercion or control? Does the person have the mental capacity to make these decisions? How do we know? And are they able to carry out their decisions? Recognise that something else may be causing this situation and think wider than what can be seen and is currently known. Ask yourself questions like, why are services being ignored, appointments being missed and offers of help being refused?
Hello, my name is Trudy Wellington. I work for Adult Social Care, Leeds City Council as a safeguarding and risk manager. I am very pleased to be taking part in this video that is raising awareness about working with self-neglect. Self-neglect is not a lifestyle choice, and hopefully with more awareness we can together deconstruct the stigma, misconceptions and stereotypes associated with this. Always care. A is for assess the risk and the person's needs. Does anything seem or feel wrong or not quite right? Does the person understand the risks? Do they need information to be presented in a different way to help them understand what could happen to them? Or do they know anyone who could help make a difference? It takes time to work with self-neglect, and it is important to go at the person's pace. Be patient and be honest. Where possible, involve family and friends in assessments and care planning. Always work with multi-agency partners. Pool information, share risk and mental capacity assessments. Agree risk management plans and consider the range of legal options available. Be realistic and recognize that seemingly small achievements make real significance.
Hello, I'm Andy and I work for West Yorkshire Fire and Rescue Service as Leeds Assistant District Prevention Manager. Always care. Y is for your time to act. Engage with other agencies, seek advice and the information you need. Access services and have the courage to go that little bit further. Ask for support when you need it, and if you feel something isn't right, follow your instincts. Ask the difficult questions and speak up. It's important to share information for everyone to have the big picture about what's going on. Be confident to challenge the practice and response of others. Reflect, take action, ask questions, and challenge the usual way of doing things. Be persistent.
Hello, I'm Jill, Head of Safeguarding and Designated Nurse with NHS Leeds Clinical Commissioning Group. Me and my team provide advice and training to GPs to help them support people who self-neglect. Always care. S is for solution focused. Remember, be creative, work alongside the person to identify solutions that suit them and work at the person's pace. Don't work or plan in isolation. Be part of a consistent multi-agency team that are aware of the risks. Make sure to know who is taking the lead and how multi-agency working is being coordinated. Consider all available resources, specialist support and advice, including networks and communities.
Hello, I'm Richard. I'm lead professional for safeguarding adults at Leeds Teaching Hospitals. We hope this video helps you when you're supporting people who self-neglect, that it gives you more confidence to assess risk, be curious, understand the person and their history, and speak up about what concerns you, to ask questions and do things differently in a way that works for the person. We've developed a self-neglect policy, procedures and guidance based on the evidence of what works and what we know is best practice. This can all be found along with this video and other resources at the Leeds Safeguarding Adults Board LSAB website. They're intended to help you to do your job and to always respond to self-neglect. Remember, small steps can make a big difference. Thank you.